I'm going to hand you over now to Peter Mabbutt, the President of the British Society of Clinical Hypnosis, to make the welcome address.
Thank you, Tom. Thank you very much. And it's an absolute pleasure to welcome you all to the third International Conference in Clinical Communications and Hypnotherapy. Now, we launched our first virtual conference in the depths of the COVID lockdown to reach out, to connect and communicate with an already isolated therapy community. And I'm really delighted to say we're now in our third virtual conference, but let's not forget the 3 physical conferences that we held prior to COVID. In effect, we're 6 conferences in, and guess what? We're already planning our next one. And we've changed the name of our conferences to the Your Mind Matters Conference. And we're very proud to say that it has brought together therapists, medical doctors, professionals, societies, and even policymakers. Everyone who has attended and who is here today is united by the desire to share, to connect, and to grow. And your response has been tremendous. We have just over 500 delegates registered for the weekend, and a really big thank you to all of you for joining us from wherever you are in the world to celebrate our truly international community. And please take a moment to just say hello to each other in your native language if you wish, in the chat boxes. And if you haven't already done so, do share where you're from and the work that you do. We're a very diverse community here. And many of you here today are clinical hypnotherapists. And so I would like to share a story that spans the world, but with a focus on Malaysia and Ireland. It's about one of Malaysia's more eccentric psychiatrists and the founder of the Malaysian Society of Clinical Hypnosis. Tan Sri Dato Sri Azlani Dr. Mahadevan is one of Malaysia's first psychiatrists. He was responsible for opening the first psychiatric hospitals in Malaysia and for then successfully discharging patients in care back into the community. He was and still is frequently and aptly referred to as Mad Haven. He has an amazing passion for horses and remains a guide to many of us today, and I'm very lucky and honoured to count him as a personal friend. Less well known is the story of his compassion offered to someone who was badly injured in a roadside accident. It's an interesting story and an event which placed Malaysia firmly on the world map of clinical hypnosis, and one that brought clinical hypnosis to the attention of the world's media. Tan Sri Mahadevan was a young psychiatrist in Dublin in 1965 when he came upon a terrible road accident. A truck transporting cattle had ploughed into a car and the roof had collapsed and there were cows roaming the street. And there were 4 people in the car, a mother, a father, both in the front seats, and a daughter and her pregnant sister in the back. They were rushing to hospital in anticipation of the birth of a new child. The mother was tragically killed outright, and the father was pinned under the wreckage, helplessly watching his 2 daughters as unfortunately they'd bled to death. A crowd obviously had gathered, and they were calling in desperation for a doctor to help. The young Tan Sri Mahadevan was at the scene, and he knelt down and took the man's hand in his own. And what he said changed history just a little bit. So let me tell you what he said in his own words. He said, "I have no pills and no potions, but if you agree, I do have a method called hypnosis that could help." And the man agreed, and Tan Sri took hold of him, told him to look into his eyes and go deep, deep asleep. And through hypnosis, there on the streets of Dublin, the father was stabilized, and the surgeons and medics who had arrived by this time were able to do their work quickly and efficiently. The father survived and never forgot this kindness, and the British press ran the story, and as a result, an anonymous sponsor reached out to grant Tan Sri Mahadevan a significant annual stipend to travel the world and learn more about clinical hypnosis. Sometimes a little compassion really does go a very long way. And through his travels today, Malaysia has connections with some of the great researchers and clinicians of 20th century hypnotherapy. And this includes John Hartland in the UK and the famous father and son team, Drs. Herbert and David Spiegel in the US. And it's not surprising that the father in Dublin valued Tantri's act of compassion. Nearly 40 years later, we saw just how much this was. In 2007, two buses collided in Sweden in an equally horrendous accident. And 5 years later, when researchers asked the 56 survivors what they remembered most out of the incident, two things stood out. One, the pain of the physical impact, perhaps not surprising, and two, the lack of compassion they experienced from the hospital staff and caregivers. Compassion matters, and it makes a difference. If you're compassionate, you're more likely to be meticulous and less likely to make a mistake that ends in expensive medical litigation. But there are also physiological effects of compassion. We know that compassion can buffer stress-mediated diseases, and it can certainly modulate a patient's experience of pain. Research from Wisconsin University, based on patients with the common cold, shows that compassion, as rated by patients themselves, is associated with an enhanced immune system response, shorter duration of symptoms, and a reduced severity of those symptoms. Just as importantly, when we communicate with compassion, it has an impact on patient self-care too. A study based on 1,700 patients with HIV at Johns Hopkins showed that compassion is associated in a 33% increase in patients' adherence to medication and treatment, and a 20% higher chance of having no detectable virus in the blood. Finally, compassion is also associated with a lower cost of healthcare and lower hospital charges for patients. And research shows that compassion for others can have a direct beneficial effect on your own well-being, counteracting the negative impact of stress pathways and negative emotions. In short, caring for others indirectly allows you to care for yourself. So what is compassion, and what does it have to do with revolutionizing healthcare? Well, scientists define compassion as an emotional response to another's pain or suffering involving an authentic desire to help. Our speakers this weekend are physicians and therapists who have defined their practice in terms of the compassionate way they communicate with their patients and clients. Sometimes it takes a little longer, but the quality of experience and the long-term benefits to the client can be transformative. The bottom line here is that if healthcare providers spent more time talking to patients, it's possible that we wouldn't need so many tests and perhaps fewer referrals. And yet, a Harvard study showed 56% of physicians in America, and probably by extrapolation globally, believe that they don't have time for compassion. Princeton University conducted a study that debunked that myth, showing how long it actually takes for a healthcare professional to show compassion and for a patient to perceive the experience of compassion. And the results were very salutary, and there was a simple finding. It takes 40 seconds to make a meaningful expression of compassion. I'd like to share with you exactly what was said to the research group of oncology patients, where the primary outcome measure was anxiety. At the start of the consultation, the oncologist said, "I know this is a tough experience to go through, and I want you to know that I'm here with you. Some of the things that I say to you may be difficult to understand, so I want you to feel free and comfortable in stopping me if something I say is confusing or doesn't make sense. We're here together and we'll go through this together." At the end of the consultation, they said, "I know that this is a tough time for you, and I want to emphasize that we are in this together, that I will be with you each step of the way." And patients randomly allocated to an oncologist using compassionate communication were shown to have significantly less anxiety than those who received usual care. Now, our speakers in this conference have each in their own individual way said to themselves and to their patients and clients that compassion matters. They have negotiated and surmounted administrative challenges and been impervious to collegial ridicule and dismissed concern that longer sessions would reduce profits. They've shown that compassion can and does make a difference. And we're truly honoured to be sharing this platform with them. There are 500 people in the audience this weekend. Each of you has made an investment in your own way through the care that you show your patients and clients, or the way you teach future generations. The value you place on how we communicate shows that compassion matters. And there is a revolution quietly afoot within healthcare, and as part of that revolution, I'm proud to welcome you all today. So without further ado, I'd like to hand you back to Tom Connolly, our MC for the weekend, so that we can get the third Your Mind Matters virtual conference underway. Thank you all so very much, and I hope you have a wonderful weekend.